Hi everybody, it's Dr. Tracy Papa. Welcome to the channel. If this is your first time here, I'm really glad to see you, and I hope you'll find this a really good resource for your pregnancy and all of these odd random questions that you have about what to expect. Don't forget to subscribe to the channel. Turn on your notifications if you want to be the first to know when new content comes out. Today, we're going to talk about something that I tell patients almost every day of the week. When you come to the Maternal Fetal Medicine office and we find out that your baby has a condition, maybe it's a birth defect, maybe you have gestational diabetes, maybe you've been diagnosed with high blood pressure, maybe you have another medical problem or your baby has an issue or a chromosome abnormality, one of the last things I always tell people is please don't go home and Google this. And of course, I know that that's exactly what you're going to do because that's what I would do. You want to know everything you can about what's going on with your pregnancy or your high blood pressure or your baby's heart abnormality. Hopefully, if your baby's been diagnosed with a condition, we've done a good job of trying to anticipate and answer all the questions that you have. But you're going to think of questions usually in the parking lot when you're on your way home, and you're going to go home and you're going to Google ventricular septal defect or tetralogy of Fallot or whatever it is that we have diagnosed you or your baby with. And so here are a few tips on how to Google smart. First thing is that if you have any assumptions about whether the outcome of your pregnancy is going to be good or going to be bad, you're going to find information that's going to support the assumption that you're making. That's called confirmation bias. Sometimes that can be a really good thing because if you expect good to happen, if you expect that people are going to be nice to you, usually they are. That's been my experience at least. But if you expect that your baby is going to die, or if you expect that the outcome of your pregnancy is going to be bad, you can certainly find plenty of information on the internet to back up that assumption too. One of the things that's key when you're searching a condition is to look at reputable websites. So I usually tell people any website that ends in .edu or .org is more likely to be a reliable source of information. So I like to use the Children's Hospital websites. Texas Children has a good one. Children's Hospital of Philadelphia also has a great website. Cincinnati, San Francisco, Florida. There are a whole lot of pediatric websites associated with universities that do a really good job. So Children's Hospital of Philadelphia is called CHOP, and their website is chop.edu. If you go into that website, or Texas Children's or Herman Memorial or any of the big fetal or pediatric centers, then you're going to find information on what you want. They usually have their own search engine, and if you plug in twin transfusion or ventricular septal defect, it will take you right to images of a baby's heart and diagrams and all the ways that things can go awry in development and treatments that they offer after delivery. There are also really good websites that end in .org, so there are a lot of support organizations. If your child, for instance, has Down syndrome or trisomy 18, any organization that ends in .org usually has a lot of information for parents and ways that you can engage with their community and get the information and the support that you need. On the other hand, if you go to joesblog.com, you're going to get a lot of opinions. Sometimes the information is really good, and sometimes what you want to read or you want to hear about is one person's experience with actually having this condition or having a baby with this condition. But remember that these people are parents and they're often not physicians themselves, or they don't have a medical background, and how they interpret the information that they were given during their pregnancy is not necessarily the way we would explain it, and it's not always correct. So if you're going to go to a .com website or someone's blog, just remember that they're telling their story. They're not necessarily giving you medical information. So sometimes these things can be a really great resource, and they can give you a lot of comfort, especially hearing someone else's story when they've been through the same situation that you find yourself in right now. So I won't say that they're not useful at all, but just remember that if you want medical information and you want information about what's happening with your baby's heart or spine or whatever, go to the medical websites and the educational websites. And if you want to know somebody's experience with having a baby with that condition, then a blog is fine. So good luck on your search. Remember that you can usually call your doctor back if you have left my office or any maternal fetal medicine provider and you think of questions. Call us back, make another appointment. We're always happy to sit down with you and your family in a telehealth environment or a group setting to try to answer your questions and give you a better idea of what to expect. Good luck with your pregnancy. I hope you like what you're seeing. Don't forget to subscribe to the channel, turn on your notifications so that you can find out when a new episode comes back.